We welcome our viewers around the world. This video is part of a series from our educational channel, focusing on the important topic of infant mortality. We encourage you to watch the other videos in this series to gain a deeper understanding of this global issue. We thank the public health and medical experts who contributed to this vital content. Please remember to subscribe, like, and share to help raise awareness and support meaningful change.
The learning objectives of this video presentation are on your screen. We highlight the urgent issue of infant mortality, beginning with the message that all infant lives matter. It compares infant mortality rates in the US, UK, and Japan, and explores why the US continues to lag behind. We examine the highest and lowest state-level rates across the US and break down disparities by race and ethnicity. The video also covers the increase in infant deaths between 2021 and 2022 in specific groups and concludes with next steps to save lives. On your screen are graphs of infant mortality rate in the United States, United Kingdom, and Japan. The United States has the highest infant mortality rate at 6, followed by the UK at 4 and Japan at 2. Data are from 2023 and are per 1,000 live births, according to the United States Centers for Disease Control and Prevention. In 2022, more than 20,500 infants died in the United States. The top 5 causes of death with percentage rates were: Number 1, birth defects, accounting for about 20% of all infant deaths. Number 2, preterm and low birth weight, responsible for around 14%. Number 3, sudden infant death syndrome, which made up about 7%. Number 4, unintentional injuries such as motor vehicle injury, with approximately 7%. Number 5, maternal pregnancy complications, with approximately 6%. On your screen is a color-coded map of infant mortality rate in the United States with the most recent data in 2022. Mississippi has the highest infant mortality rate with 9.11. The other states listed in order of highest mortality rate and with infant mortality rate at 7 or above per 1,000 live births are South Dakota, Arkansas, Delaware, Louisiana, West Virginia, Indiana, Ohio, and Georgia. Massachusetts has the lowest infant mortality rate with 3.32. The other states listed in order of lowest mortality rate and with infant mortality rate below 4 per 1,000 live births are New Hampshire, New Jersey, and Rhode Island. 12 states had infant mortality rates significantly lower than the national infant mortality rate. California, Colorado, Connecticut, Massachusetts, Minnesota, Nevada, New Hampshire, New Jersey, New York, Oregon, Rhode Island, and Washington. 19 states had infant mortality rates significantly higher than the US infant mortality rate: Alabama, Arizona, Arkansas, Delaware, Florida, Georgia, Indiana, Louisiana, Michigan, Mississippi, Missouri, North Carolina, Ohio, Oklahoma, South Carolina, South Dakota, Tennessee, Virginia, and West Virginia. On your screen is a graph of infant mortality rate by maternal race and Hispanic origin as of 2021 and 2022. As of 2022, the non-Hispanic Black population have the highest infant mortality rate at 10.9, followed by non-Hispanic American Indian and Alaska Native at 9.06. The lowest rate is in the non-Hispanic Asian population with 3.51. It is encouraging to note that the infant mortality rate among the non-Hispanic Asian population highlighted in the red box, declined from 3.69 in 2021 to 3.51 in 2022. We hope this positive trend continues. Unfortunately, two groups highlighted in the red boxes experienced statistically significant increases in infant mortality rates from 2021 to 2022. The rate for non-Hispanic American Indian and Alaska Native populations rose from 7.46 to 9.06, while the rate for non-Hispanic white population increased from 4.36 to 4.52. We hope to see these trends reverse, with significantly lower rates in the coming years. Here are recommendations to reduce high infant mortality rate in the United States. Number 1. Ensure universal access to quality prenatal and postnatal care by expanding Medicaid, funding community-based programs, and adopting best practices from countries like Japan and the UK. Number 2. Target high-risk states and populations with focused investments, including perinatal quality collaboratives, rural provider incentives, and extended postpartum care. Number 3. Address racial and ethnic disparities through culturally competent care, workforce diversity, anti-racism training, and support for social determinants of health. Number 4. Launch a coordinated national initiative with measurable goals, robust data collection, and increased funding for research, innovation, and evidence-based interventions. In summary, this video explores infant mortality rates in the US, UK, and Japan, highlighting stark differences. It also breaks down US data by state, race, and ethnicity, revealing critical disparities. Learn what's driving these gaps and what can be done to reduce preventable infant deaths. The learning objectives have been met. We hope you enjoyed this video presentation. If you found this presentation informative and educational, please give this video a thumbs up and consider subscribing and sharing with family members, friends, and colleagues. Your support helps us create more informative and educational content. Until next time, stay strong, stay hopeful. This has been a presentation of Oppo Mulero Media, LLC.